Good day everyone, I am Dr. Yang. As a health expert, it is my privilege and responsibility to provide you with clear, comprehensive, and crucial information about the medications you may be taking. Today, we are going to have an in-depth discussion about a very commonly prescribed heart medication, Metoprolol, which you might know by its brand names, Lopressor or Toprol XL. This is not just a lecture, this is a conversation about your health, your body, and the empowerment that comes with knowledge. So, I invite you to settle in, focus, and truly absorb this vital information. And if you find this valuable, please, share this knowledge with your loved ones, like this presentation to help others find it, and subscribe for more straightforward health advice because understanding your health is the first step towards taking control of it. Let's begin by understanding what metoprolol is and why it is so widely used. Metoprolol belongs to a class of drugs known as beta blockers. To understand how it works, imagine your nervous system has something like an accelerator pedal for your heart. This pedal is called adrenaline, or more technically, the beta receptors. When you are stressed, anxious, or exercising, your body presses down on this accelerator. Your heart beats faster and with more force, and your blood vessels constrict, all leading to an increase in blood pressure. This is a fantastic system for fight or flight, but for many people, this accelerator is stuck partially down all the time, leading to chronic high blood pressure, heart strain, and irregular rhythms. Metoprolol works by gently blocking these beta receptors. It's like putting a wise, calming hand on that overactive accelerator. It tells the heart to slow down, to beat less forcefully, and it helps the blood vessels to relax and open up. This combination effectively reduces blood pressure, eases the workload on the heart, and can steady irregular heartbeats. Because of these powerful actions, doctors prescribe metoprolol for a range of conditions: essential hypertension, which is high blood pressure, angina pectoris, the chest pain caused by reduced blood flow to the heart, following a heart attack to protect the heart and prevent another one, and for heart failure, where it helps the weakened heart muscle work more efficiently. It can also be used for managing certain types of tremors and preventing migraine headaches. Now, while metoprolol is a cornerstone of modern cardiology and has saved countless lives, like all powerful medications, it is not without its side effects. It is absolutely critical to remember that not everyone will experience these, and for many, the benefits of controlling a potentially life-threatening condition far outweigh the manageable discomfort of some side effects. However, being aware of what could happen allows you to be a proactive partner in your healthcare. You can identify issues early and work with your doctor to address them, rather than suffering in silence or discontinuing the medication abruptly, which can be very dangerous. Let's walk through the potential side effects, starting with the more common ones. The most frequently reported side effects are often directly related to the drug's intended mechanism, slowing things down. So, many people experience fatigue, tiredness, and a general lack of energy. This makes perfect sense. If your heart isn't being revved up as high, you might feel less revved up overall. This often improves after the first few weeks as your body adjusts. Dizziness or lightheadedness is also very common, especially when you first start the medication or when your dose is increased. This is primarily due to the drop in blood pressure. You might stand up quickly and feel a little woozy. Cold hands and feet can occur because the beta receptors that help dilate blood vessels in the extremities are blocked, potentially reducing blood flow to these areas. Some people report shortness of breath or wheezing, which is a very important one to watch. While metoprolol is cardioselective, meaning it prefers to block beta receptors in the heart, at higher doses it can also affect receptors in the lungs, which can be problematic for people with asthma or COPD. Gastrointestinal issues are also on the common list. You might experience nausea, stomach pain, constipation, or diarrhea. These are usually mild and transient. Another common and often surprising side effect for men is sexual dysfunction, which can include decreased libido or erectile dysfunction. This is a known effect of beta blockers and can be a significant reason some patients want to stop the medication. It is essential to have an open conversation with your doctor about this. There are often solutions or alternative medications that can be explored. Beyond these common effects, there are less frequent but more significant side effects that warrant immediate medical attention. These are the ones you must not ignore. If you experience a very slow heart rate, known as bradycardia, where your pulse drops below 50 beats per minute, or if you feel like your heart is skipping beats or palpitating in an unusual way, you must contact your doctor. Severe dizziness or fainting could indicate that your blood pressure has dropped too low. New or worsening shortness of breath, especially if it's accompanied by swelling in your ankles, feet, or hands, or if you suddenly gain weight, could be a sign of worsening heart failure or a serious reaction. Depression, confusion, or vivid nightmares are also reported by some individuals. While not extremely common, any significant change in your mood or mental state should be discussed with your healthcare provider. A rare but serious side effect is a skin rash or itching, which could indicate an allergic reaction. This brings us to the most critical part of our discussion, the precautions you absolutely must know and the actions you must take to ensure your safety while on metoprolol. Knowledge of these precautions is what separates a successful treatment from a potentially harmful situation. First and foremost, you must never, ever stop taking metoprolol suddenly. This is not a suggestion, it is a stern warning. When you take metoprolol consistently, your body becomes accustomed to a slower heart rate. If you abruptly quit, you unleash a phenomenon called rebound hypertension or beta blocker withdrawal. It's as if that accelerator pedal we talked about slams to the floor with no restraint. Your heart rate and blood pressure can skyrocket to dangerously high levels, potentially triggering severe angina, a heart attack, or irregular heart rhythms. If you and your doctor decide you need to stop this medication, it must be done under strict medical supervision with a very gradual, tapering dose over a week or more. The second cornerstone of safety is complete transparency with your doctor. Before you even start metoprolol, your doctor must have your full medical history. You must inform them if you have a history of asthma, chronic bronchitis, emphysema, or COPD. As mentioned, beta blockers can cause life-threatening bronchospasm in people with these conditions. There are sometimes reasons to use them cautiously, but your doctor needs to know. You must disclose if you have diabetes. Metoprolol can mask some of the key warning signs of low blood sugar, specifically the fast heartbeat and tremors. You might only experience the dizziness and sweating, making it harder to recognize a hypoglycemic episode. It can also slightly increase blood sugar levels. It is vital to tell your doctor if you have a history of a slow heart rate or heart block, as metoprolol will slow it down further. Inform them of any liver problems, as the liver metabolizes the medication. Crucially, you must provide a complete list of every other medication, supplement, and over-the-counter drug you are taking. This includes vitamins, herbal remedies like St. John's wort, and especially cold medicines. Many decongestants contain stimulants like pseudoephedrine that raise blood pressure and heart rate, directly opposing metoprolol and creating a conflict inside your body. Other blood pressure medications, including calcium channel blockers like diltiazem or verapamil, can amplify the effects of metoprolol, leading to an excessively slow heart rate. Medications for depression, such as fluoxetine and paroxetine, can also interact. This is why a full list is non-negotiable. For those of you who are pregnant, planning to become pregnant, or breastfeeding, this requires a very careful risk-benefit discussion with your obstetrician and cardiologist. Metoprolol does cross the placenta and into breast milk. It can potentially cause a low heart rate, low blood sugar, and other issues in the newborn. However, uncontrolled high blood pressure or heart conditions in the mother are also very dangerous. This is a decision that must be made meticulously with your healthcare team. Now, let's talk about lifestyle and daily precautions while on metoprolol. Because this medication can cause dizziness and fatigue, you need to be cautious when driving, operating machinery, or doing anything that requires alertness until you know exactly how this drug affects you. Do not test your limits. Be especially careful when standing up from a sitting or lying down position. Do it slowly to give your body time to adjust and prevent a sudden drop in blood pressure from making you dizzy and falling. Alcohol should be consumed with extreme caution, if at all. Alcohol can also lower your blood pressure and intensify the dizziness and drowsiness caused by metoprolol. If you have the Toprol XL version, which is the extended-release tablet, it is designed to release the medication slowly over 24 hours. You must never crush, chew, or break this tablet. Doing so will release the entire dose at once, leading to a dangerously high concentration of the drug in your system, potentially causing a severe drop in blood pressure and other serious effects. If you have trouble swallowing pills, talk to your doctor about alternatives. Monitoring is key. You should be checking your blood pressure and heart rate regularly as advised by your doctor. Keep a log. This information is incredibly valuable for your physician to determine if your dose is correct or needs adjustment. Pay attention to your body. Note any new or worsening symptoms and report them. Your role is to be the observer and reporter. Your doctor's role is to be the interpreter and prescriber. In conclusion, metoprolol is a powerful, life-saving medication for millions. It controls blood pressure, protects the heart after attacks, manages angina, and improves outcomes in heart failure. Its side effects, while real and sometimes bothersome, are often manageable. The path to safe and effective treatment is built on 3 pillars. First, unwavering adherence to your doctor's instructions, especially never stopping cold turkey. Second, complete and honest communication with your healthcare team about all your conditions and all your medications. And third, mindful living, being aware of how your body feels, making smart choices about activities, and monitoring your vital signs. Your health is your greatest asset. Being informed transforms you from a passive patient into an active, empowered participant in your own care. You now possess knowledge that can keep you safe and make your treatment with metoprolol a success. But this message shouldn't stop with you. Heart disease affects countless families. Someone you know might be starting this medication and feeling scared or confused. You can be their source of clarity and comfort. So, I urge you, if you found this information valuable, please share this speech. Like it so that algorithms can show it to others who need it. And subscribe for more clear, straightforward, and expert health guidance. Together, we can build a community of informed individuals making better decisions for their health. Thank you for your time, and take good care of yourself.